Howdy! Today I want to talk a little bit about this book, The Black Sheep Therapist. I have it on my Kindle, which is why I'm not rocking a hard copy, but hard copy is on its way. I think that every therapist, counselor, coach who's into transformation and uses tools like tarot, astrology, Reiki, all of these energy-based worldviews, all y'all should grab this book. And I don't say that lightly, but I say that because I think what Dr. Vitolo, Tina Vitolo is the author, what she has done is something really great. She's given us essentially a roadmap to creating a practice based in integrity, one that actually integrates, it plugs in to existing structures. And by structures, I mean licensure requirements, research, and different frameworks and modalities that we use as practitioners who are serving individuals, improving their mental health and their well-being. So, a little bit of backstory before I get into the book. I did my master's degree through a school in London, and I did that because I wanted to study psychosynthesis, which is my framework, my worldview, my way of understanding the world. It is a transpersonal psychology that seeks to support individuals, expanding consciousness, integrating pieces of themselves, their soul, back into agency. This is my definition. It's a very broad definition. It's a psychology of wholeness, and it takes us beyond the mind into much stranger waters. Let's say that. And there is no academic master's level psychosynthesis program in the United States. So that's why I did the thing in London. I did clinical training through the program. However, I hit a massive snafu where I could not pursue licensure in the United States because of accreditation challenges. The UK educational provisions and the US educational provisions, they ain't integrating, they ain't talking to one another in this case. And that makes sense, right? Because mental health practices, counseling, psychotherapy are really related to the geopolitical structures in place. And there are differences in working with populations that are in the US. There are differences in working with systems like the US healthcare system that is really, frankly, based in risk management and is focused on pathologizing, diagnosing, keeping people in a system that likes to categorize inner experience. I don't think that's always possible or the case. So when I was looking to establish my practice, I found Dr. Vitolo through a group on Facebook, Black Sheep Therapists. And already there, she was talking about integrating different energy-based practices, making your own practice, mental health care practice, and what your offerings are, making them more shaped to something that would work well in the ecosystem of the United States mental health care system. Okay. Big bunch of ideas. Basically, I had a one-on-one with her and I explained to her my situation, which also involved explaining my story, because I feel very strongly about psychosynthesis. And I'll never forget, I actually remember I took this call Well, I was in my truck, so I was parked in a parking lot. And she said, look, you have a worldview. You have a framework, a way of understanding the psyche. That's what you need. You have an established way of working with people. Base your practice around that. So maybe you don't call yourself a counselor. You don't seek the licensure because you're looking to retain how you practice, which for me involves a lot of guided meditation, visualization, stream of consciousness. We do a lot of talking and leading with heart to get to what is affecting the soul, the human experience that the soul is having. She said, just set yourself up with a good waiver intake form, set yourself up with a good way of setting your own boundaries. I had a supervisor, I had someone who could guide me. I have many other colleagues who are practitioners. I have colleagues who are practitioners in Europe. So it really came down to me deciding how I wanted to structure my offerings and whether I needed to work within the system or not. And turns out, big nope, I'm not dealing with insurance. That's my choice. And I remember sitting in my truck and having this conversation and feeling so seen and so heard by Dr. Vitolo that I let the licensure thing go. And it was a thing for a long time. Do I do another grad program? How do I make this work? I didn't want to be far removed. I didn't want to spend more money and more time in school. I wanted to work with individuals. And I was working with individuals. I just had to frame it in a way that upheld my integrity and honored my practice and my education and my worldview. So this book does that for you. I mean, it doesn't tell you, like X, Y, Z, take these steps. It invites you to explore your story, why you're doing what you're doing. And she says your framework is gold. You layer on different things, but how you understand the model of the psyche, of the mind, is what you're really working with, and how you clearly define what it is that you're doing, whatever you layer on top, is what you need to be clear on. So I guess it's kind of, it tracks that I have the book on my Kindle or on the Kindle reader, because it's a very, very interactive and engaging book. There are several places where you can jump onto a QR code. Dr. Vitolo mentions the Black Sheep Therapist group, and it's a wonderful group to be part of for community, for questions, for education. She has so many offerings that are wonderful. So what she has also done, and this is what I mean by integration, she's done the research. She has the receipts. She's contacted and researched the boards and the requirements state by state, deconstructed language, constructed an understanding that really says having licensure doesn't necessarily exclude you from bringing in and pulling an oracle card, bringing in Reiki, creating a licensed practice with all of these different tools added on. But what it does do is give you the opportunity to create your structure within those parameters, the structure for your practice within those parameters. So there's a lot of great links, great reference list of works cited within this book, and it's an easy read. It is not something that you're gonna hit the snooze button, because you're going to be very activated and encouraged to bring together your passions, your loves into your practice. Because what we're doing is serving, right? We are seeing someone else, knowing what we can offer them, and dialing in with specificity to those people. There's something about lived experience that is so valuable to bring into client or patient sessions. And well, I mean, it's not, there is something, it's the story. It's like, you can speak to it, you can empathize from a point of lived experience. There's also something about lived experience as a practitioner, knowing that you've been in the system, you've been in burnout, you've been part of larger practices that don't really align with your purpose and your values. So when you strike out and create a practice that is attuned to who you are, your beliefs, and your own practices, I think that it makes you stronger and it makes you softer. Because again, those who want to reach you will, because of what you're offering. So that's the invitation to not hold back. It's the invitation to get clear, just to get clear. Again, some of these energy-based practices, modalities, framework, they're not mutually exclusive to what already exists in the mainstream American healthcare system, the mental health care system. It's just about defining your offering, being very clear how it relates to how you see the world. And frankly, I think this book, The Unsaid Thing, bearing the lead here, the most important part is finding agency as a practitioner. Because if we limit ourselves by what we can't do, then we're losing out on the opportunity to show what we can. And that includes showing what we can because our story has brought us to the point where we know the value of some of these energy-based practices. That's it. That's the rub. I very highly recommend Black Sheep Therapist if you are looking to define and expand your clinical practice through energy-based tools and paradigms. I don't know why I'm thinking of the phrase Siram Sukham Asanam, root down to rise up. And so this is what this book offers you. Root down in what you do know. Root down and get very clear on what you believe, how you believe the world is of the mind is constructed, how the psyche is constructed. And be with that.